I grew up in South Dakota. I moved to Colorado when I was 18. I moved to Leadville in 1994. I started hiking when I moved to Leadville. I have a group of ladies we call the Huff and Puff group, and during the summer we hike usually 2 days a week. There's something about conquering a mountain or conquering a trail that is exhilarating. I started feeling the pain probably back in May of 2018. Well, I had trouble walking, but also the strain of trying to keep that pain at bay was debilitating in itself.
She came to me because she's had a previous back fusion, and she's a very active lady.
They showed us the sacrum.
She was getting arthritis in her SI joints. So it's not a joint that you're going to miss the motion that you don't have, but it's a joint that gives pain, and that affects then your whole lower body. We elected to put in an SI fusion, which is a percutaneous way, so it's really small incisions to stabilize that joint.
So it wasn't until middle of November that I could have the operation.
So you can see that there's a pattern in here. This is laser etched, so bone can go through it when you put it in. So think of this as when they implant it, it's triangular, so it controls rotation. And these holes already have bone graft in it from her own pelvis when we're putting it in. And eventually this will incorporate into the implant. So that implant now is bridging, this is the joint here, it's bridging this and this together.
I was with my daughter for 2 weeks in my recovery. At that point is when Dr. Desai asked if he could have his picture taken with me. He said I was the oldest patient he had done this procedure on, and he wanted to have a picture. So we did.
She's an 84-year-old athlete that refuses to give up. Her wish was to go snowshoeing.
I was snowshoeing this winter and walking. The experience in seeing Dr. Desai was very positive. Today I feel wonderful and joyous.